Guys, and welcome to my free training on how to improve your back pain. Specifically, this presentation is going to be on how to improve your back pain in 7 days or less, even if you've tried physio, chiro and other passive methods. Okay, so I'm going to teach this by showing you the system I use to overcome my own back pain without medical intervention in 90 days, and what I'm doing with my clients and other people right now to do the same thing as well and help them. Okay, so here's a few testimonials. There's Mike's testimonial. He had really poor posture and bad back, mainly from his occupation. That is now eradicated since then, and he has no longer got any pain. His posture has improved. His strength has also improved. Adam, another one of my clients, experienced quite a bit of pain in his lower back when he was doing deadlifts, and it was quite, I don't want to say chronic, but it was ongoing for quite a while, longer than it should have been, and now he has no more pain. This is Liz. Liz's was a bit different. She had a bit of pelvic girdle pain as well as lower back pain, which was after a second pregnancy. She also now no longer suffers with any pain at all. Okay, so 3 different, if you want to say, cases there, different causes of pain, but ultimately it's a very similar process which you follow to help eradicate it as well. Okay, so this training is for you if you're a busy professional stricken with back pain and you want to be able to go back to the gym and compete in your sport again. You feel hopeless and depressed and you want to get your livelihood back. You want to be able to play with your children again. You want to be able to be more intimate with your partner again. Okay, so my promise to you is that I'll provide the blueprint for that over the next 20 minutes that we have together. Okay, so does this sound like you? Everything seems to be a short-term fix. You've tried all passive methods, whether that's chiros, physios, acupuncture, sports therapists, and none of it seems to be working for you. Okay, it might provide a bit of short-term relief, but for some reason you are still suffering with some degree of pain in your back. You can't pick up your children. You're off work constantly with the pain. It's quite a common one as well. Frustration because you can't train anymore. I know that was definitely me. Anyone else who's reasonably active and they like to work out, definitely something that you will experience, and if you do have back pain. Okay, does this also sound like you? You hate relying on other people. Yep. You can't perform simple tasks. That might be reaching something from the shelf, twisting, bending, picking something off the floor, shutting the car door, putting socks on, getting in and out of the bath. Simple stuff that you take for granted. You're relying on medication to numb the pain and mask the symptoms. That's another common one. Okay, so perfect if that is you. So what we're actually going to talk about today are the 3 main features that you need to focus on when it comes to taking the first step in getting rid of your pain. Now, firstly, I just want to make you all aware that this is a long-term process. I'd say 3 months minimum. There's no quick fix or miracle pill for this kind of thing. Okay, so I just want to make that clear first of all. Right, so what we're going on to now. Mercifully brief introduction about me. Strength and rehabilitation coach and sports science and coaching graduate. Previously suffered twice with my own 2 disc herniations, L4 and L5. Fully rehabilitated myself and now help other professionals do the same. Okay, use a 5-step system which we will go into. Right, what you will learn today. Secret 1, mindset. So first of all, you need to change your mindset and understand that the underlying problem cannot be solved with simple passive methods. Okay, and there's a little description there that you can read over as well. Okay. Secret 2, we're going to go into more information anyway as we go along. Secret 2, posture and technique. You need to make these changes to your bad habits, immediate changes which we'll also go into as well, and correct any bad postural or lifestyle habits that you may have, and you need to become habitual. Okay, so as it says there as well, think about how the injury occurred. Did you injure yourself picking something up? Yeah. Was it the object you were picking up that was the reason why you injured yourself? No, it wasn't, and we will explain why that is as well as we go along. And secret 3, mobility and pliability. I'll give you a bit more in-depth description of what that is further along. But basically, are your hips, your spine, other areas of your body, are they mobile enough to adapt to the movement that your body is asking it to do? So whether that's picking something off the floor, squatting down, bending over, anything, simple task like we named before. Can your body do it safely and correctly? Okay, so we're going to go into that. Right, secret 1, reconstruction of mindset. Okay, so let's move on to the first slide. That will allow me to, there you go. So you're constantly receiving mixed reinforcement from Facebook groups and Google searches, and you don't know what to think. Obviously, your doctor as well. You might be having mixed feelings about what the doctor says to you as well. So your beliefs and expectations are not of a growth mindset. So basically, a growth mindset is one that embraces the challenge and any mistakes that you make. And when I'm referring to a mistake, I'm referring to it might not necessarily be something that you're aware of. So let's use my injury for example. So I had a herniated disc in my lumbar spine, and I understood that my issue was purely mechanical and that I couldn't perform the movement that I was performing, which at the time was a squat, with the required mobility to be able to do it safely and efficiently. And that actually translates to anything. So like I was saying earlier, whether you're picking an object off the floor, if your spine, your hips, other areas of your torso and your lower body as well, you don't have the sufficient mobility to perform the movement safely, then it can be a defining moment which causes the injury, or it can be a build-up of things. Some people might have lower back pain at a low degree, which isn't bothering them too much, and then bang, eventually they're at a level where it's a 10 out of 10 and it's unbearable. So it really depends on the individual, but a lot of the time it can be, or most of the time it is, due to a build-up of these things because of what we're about to go into. It's just a long period of time where you are practicing poor posture, you've got poor technique on when you're lifting things, not just in the gym, just in general, and weak muscles, tight muscles around the area which is required. With your hips, which you use to actually lift the object up off the ground. So that's the first one. Understand that your situation is unique, okay, and try and understand what the underlying problem is first, and then work backwards from there. So stop trying passive methods, like we said before, if you're not seeing results from it. Okay, it doesn't make sense, and obviously there's a statement here from Einstein. It's foolish repeating effective actions. One popular formulation prevents this point harshly. The definition of insanity is doing the same thing over and over again and expecting a different result. And that's what a lot of people, including myself back in the day, do. And it doesn't make sense. You know, you'll see the physio every week. You'll see the chiropractor every week. You'll see the doctor every so often. And you'll try methods, acupuncture and other methods, passive methods, which aren't working for you or not actually seeing results. So it's something else that you need to focus on. So if we move on, what can happen if you stay in this phase and you don't change your mindset? Well, mental rumination can happen. So at the top there it says train insane or remain the same. How about if you are insane, then you will remain the same? Basically, as Einstein said, the quote, if you do the same thing over and over again expecting a different result, that's the definition of insanity. You will not change. You will not see any improvements at all. So that's when you become into the phase of mental rumination, which, as it says there, negative, excessive and repetitive. So rumination is basically repetitive thoughts about what you think the cause is and the consequences of your negative emotional experience. Basically, you're continuously thinking about various aspects of situations that are upsetting to you. It's not something that you want to be in. It's not the phase that you want to be in. If you do stay in this phase, then your symptoms can also worsen because you're not taking action. And obviously, some of the consequences of that are listed here on this slide. So you want to get out of that phase. So what do we do instead? Okay, we've got a pyramid here. Think about the bottom being the foundation. The first thing you want to do is pay attention to when you do start having these negative thoughts and repetitive thoughts. If you do notice yourself doing it, then do something which reinforces you positively, whether that's standing up, going for a walk, doing light exercises which you feel ease the pain slightly, temporarily, even if it's temporarily. Anything that's going to positively reinforce you rather than repetitive negative thoughts. Okay, so whatever your capability, if you're capable, depending on the degree of back pain, obviously, if you're in a severe pain but you're capable of walking a few steps, a few yards for the time being, then you need to do that. If your pain isn't as bad and you've got a bit more movement and you're capable of doing extension exercises which ease the pain, which generally most people with back pain, they have pain when they flex, so extension will ease it, so then you need to do that. Anything that's going to positively reinforce it. Okay, what's next? Why has that come up first? So the next one, understand your underlying problem. What's actually the reason that's stopping you from achieving your goals? Okay, obviously we talk about mental rumination as well, your mindset, but also, do you know the reason why it happened? As I said before, you need to work backwards from there. If you've got tight hips, weak hamstrings, tight hamstrings, weak hips, weak glutes, weak spinal erectors, immobile hips as well, then all of that needs to be corrected and reversed in order to start seeing any change as well, especially in the future to prevent any further injury happening as well. And then finally, at the top of the pyramid is stop treating the symptoms. Okay, so stop with all passive methods. How long have we been doing it for and not achieving any results, as we said before? That will be one of the reasons why you end up in the rumination phase. So it's like a spiral. Okay, so you need to get out of that phase first, understand what your problem is, and stop treating the symptoms, and you're already one step closer to being pain-free. If you do that, then volition is what it will allow you to practice, and basically it says it here on the slide anyway, but volition is the power of using your will. Now I've got a little quote here at the bottom, as you can see. Now I used it because it's specific to back pain, and it says non-specific chronic back pain, but it actually relates to chronic back pain as well. There's a reason it's chronic, because you've left it untreated for such a long time. So patients with non-specific chronic low back pain are typically prescribed a regime of regular physical exercise to improve pain and function, increase workability and prevent pain reoccurrence, which is how it should be. That's how you actually rehabilitate the back. However, adherence to home exercise programs is often partial at best. Patients often fail to translate their intention to exercise, so the motivation into an action, the implementation. Volition is the mental activity by which intentions are implemented. So, for example, you know what you need to do a lot of the time. Some of you don't, some of you do. Some of you have seen a physio and they've told you what you need to do, whether that's bearing in mind the physios give you the correct exercises to perform as well. But you don't have the intention to implement your actions. So if you practice what we discussed on the previous slides, then you will notice that in fact you will start to implement and take action on what you know and the information you have to be true. So that's the first thing, volition. When it comes to your mindset, it's very, very important. Information on its own is absolutely pointless without implementation. So if your physio or your therapist prescribes you with certain exercises that you need to do, and they're telling you that it's going to help you, trust them and commit every single day towards your rehabilitation. It is your well-being at the end of the day. That's the number one thing that I'll say is consistency. You need to be consistent with these things. Okay, so next slide. Okay, secret 2. Reintroduce movement. So how to make instant changes to your lifestyle so you can see results within days. Okay, so first of all, if it will allow me to jump to the next slide. Hang on a sec. There we are. So get moving ASAP. Take immediate action. The number one mistake that most people make, including the majority of you who are watching this slide as well, make when you're suffering with back pain, is that you take no immediate action. And now that can be your downfall, obviously, as the problem, the underlying problem, as we spoke about previously, will remain or in fact get worse and worse, and the symptoms will get worse and worse, and it will be harder to reverse eventually. And the main thing we want to avoid is surgery. Okay, so take immediate action. And a lot of it's Also because you've been given mixed advice, you've been told to rest. Now, rest can be interpreted in different ways. So you need to work within your current capabilities, whether that's, as we explained previously, taking a gentle walk or minor extension exercises, minor strengthening exercises, whatever you can currently handle. That's active recovery. That's what you need to be focusing on. You don't want to take complete rest because your problem will get worse and worse and worse. And obviously, as we spoke about, your mental rumination phase, you will just stay in that phase and it will just become a spiral. Okay, so you want to take immediate action. That's the first point. Second point is your working environment, especially. So what can you change about your working environment? Does your working environment require you to sit a lot? Are you a driver? Are you an office job? Forklift driver? I've had a few clients who have forklift driver. It's the same seated position. Internal rotation of the shoulders, spinal flexion of the lower back, tight hip flexors, tight hamstrings, inactive glutes. They are all contributing factors towards your back pain. No matter what the severity is, 9 times out of 10. So what can you change? Can you change the way you sit? How are you sat right now? We spoke about it earlier. Can you stand in your job? Can you take away your desk? Can you improve your posture somehow? What can you do to make an immediate change right now? Whether that's putting a cushion behind your back when you're driving or at your desk at work to help with that extension of your lumbar spine so that it's not rounding forward. Can you pull your shoulder blades back? Can you retract your shoulders so that you're taking less stress off your cervical spine as well, so your neck? So literally just make whatever change you can to improve your posture. Make yourself aware of your current working environment. Okay, and then manage it as best as possible from there. Okay, what happens if you don't do any of that and you stay in that phase? Then, okay, you'll become a recluse as such. So these are the consequences of you not taking action, and your physical changes can worsen. But ultimately, how will it affect you? Well, there's a list of bullet points there which some of you might be able to relate to, or further down the line you might be able to relate to, but you certainly want to avoid if you've not yet experienced any of that. Okay, so what do you do instead? You take advantage. Get moving, as I said. Don't be sedentary. Take immediate action. If it's a few laps around your garden, if it's light extension, if it's making immediate postural changes, everything is going to be beneficial for that. What's your day-to-day posture like? As I've already said, how do you sleep? How do you sit? How do you pick objects up? You need to be consciously aware constantly of these things, because ultimately these are the reasons why you were suffering in the first place. Okay, so make sure you adjust your posture and you get moving immediately. Okay, and the final one is stay consistency. You will not be pain-free overnight. There's no miracle pill at all. Okay, so consistency is the key to becoming pain-free. That's a saying I like to give my clients as well. So consistency every single day, action, aggressive action every single day towards your recovery. Okay, you need to treat it like your profession. You need to show up and do it every day. Okay, so what do you actually need to do? If we look at posture specifically, can you hinge properly at the hips? For example, if you're picking something up off the ground, getting the milk out of the fridge, performing a deadlift, do you even know what a proper hinge is for a start? If you don't, then there's a problem. What's your sleeping and sitting position like? They're obviously massive contributors as well. Certain muscles can tighten up depending on your sleeping position. Does it hurt to drive? If so, you need to make adjustments. Cushion behind your back. Help maintain that extension of the lumbar spine. Okay, you want to avoid flexion at all times, so rounding of the lower back. And as I said before, and I'll keep repeating myself, these are all things that are contributing towards it, so these are all things that you need to change. Okay, And I'll repeat myself again, consistency is the key to become pain-free, so stay consistent every single day with these things, and it will become habitual eventually. If you do these things, then you will start to see some progress, the light at the end of the tunnel. Okay, so you'll see improvements, you'll regain a bit of movement, you'll gain some confidence. Most people who suffer with a severe level of pain, we're talking like 7 to 10, will experience reduced pain after a few weeks if you follow these steps. So for example, you might have a level 10 and you might reduce to a 4, for example. But during that, the chances are that you will have also regained some movement as well. Your body likes to move. If you've regained the movement, take advantage of it. Get your body moving every single day. Like I say, a lot of people, they feel sorry for themselves with the back pain. I was one of them as well. But make sure whatever that movement is that you can tolerate at the minute, you are constantly doing it. You will see improvements if you do that. Okay, so movement, important, and that's going to bring us on to our final secret or factor that we're talking about, which is mobility and pliability. Okay, so first of all, what's mobility? If you don't already know, it's the ability for your joint or joints, whatever is working at that moment in time, to move through the full range of motion comfortably. Now, a lot of people lack the efficient mobility to perform certain movements. We'll go back to that squat or the deadlift again, because they are actually functional movements which people use every day anyway, when they're not training or when they are training. But specifically outside of training, like I say, I'll use that reaching for the milk out of the fridge example, picking a washing basket up off the ground example. All of these things, if your body does not have the mobility to be able to perform them, then there is an issue there. That needs to be a priority to be worked on as well. Okay, so as much as we talk about the mental changes that need to happen, ultimately the reason is physical. Okay, you haven't got the mobility. And even more importantly, pliability. So what's pliability? It's the ability for your muscles to absorb and disperse forces efficiently. So can you safely and efficiently perform the movement your body is asked to do? Again, deadlift, picking something up off the ground. Do your joints have the pliability to perform the movement that is required on them? Okay, if the answer is no, again, that needs to be addressed as well. Okay, so it's basically the combination of mobility and strength. Strength is the foundation ultimately. Okay, so you need to have the two to be able to perform it. If you aren't mobile, you aren't strength, and you don't have strength, then you are already not in a good position and prone to injury, or at risk of injury at least, or re-injury if you've been injured before. Okay, so let's move on to the first slide. What's causing your poor mobility? Okay, 3 main things that I noticed with my own situation and several of my clients' situation as well. Posture, again, poor sitting positions, poor sleeping positions, weak muscles, stress, that can cause other muscles to compensate as well. So what will happen as a consequence is you'll have tight hamstrings, weak hamstrings, tight and weak hip flexors, internal rotation of the shoulder, so that primal sort of position, 8 positions, shoulders forward, neck forward, a lot of stress on your neck, which also supports like the spinal curve or flexion as well. So if you have internal rotation of the shoulders, likely that you might have some form of lumbar flexion as well when you are performing exercises as well. So not good. Poor lifting technique. Again, we'll use that image on the left as an example. It's a very poor attempt of touching his toes, but essentially when people perform a deadlift or they pick something up off the ground, that is what it will look like if they are untrained or they don't have the mobility required to do so. So if you look here, the weight's away from his centre of gravity, his hands are away from him, puts more pressure on his lower back, and I'm sure a lot of you probably can relate to that position as well. Okay, so needs to be addressed and corrected. Okay, so next slide. Also, if you look at the picture on the right, it's very similar. He's got a bit of lumbar flexion there at the bottom of his spine. His shoulders are internally rotated, his neck's pronated forward a bit. He will have a bit more pressure on his spine. In fact, there is a number as well. That degree of flexion of his neck can put up to 35 pounds of force on his cervical spine. Something as simple as that, typing on your laptop or even just looking at your phone. Try and avoid that position of your upper back and your rear shoulders. Try and keep your shoulders protracted. Try and keep your head neutral, your neck neutral, so that you avoid any further or unnecessary pressure on your upper back as well. Okay, and we spoke about how that can encourage lumbar flexion as well. So they both come hand in hand, kind of. A lot of people who have pain in the neck might have pain in the lower back and vice versa as well. So it's all connected. Okay, so just practice good posture, practice good lifting technique. As we said here, you need to increase your strength as well. At the end of the day, that is the foundation. The stronger you are, more mobile you are, the less prone you will be to injury. Okay, so it's not 100% avoidable, but you can try your best and give yourself the best opportunity to avoiding it in the future. Okay, so what do we need to do? In fact, where are we at the minute? Can you pinpoint whether you're stagnating or you're declining? So are you just constantly feeling a little bit of pain and discomfort all the time, or do you feel like you're now declining and your symptoms are getting worse and your pain's increasing? Okay, so obviously neither of those two phases are good. You want to reverse and prevent the two from happening, especially if you're declining. You make sure you want to improve your symptoms as soon as possible. Okay, so like I said, I told you before about lack of strength. It is probably one of the main reasons why you are feeling the back pain, and we'll talk about movement and stuff again. Your body is not neurologically efficient enough to be able to perform certain movements. So even though your joints aren't mobile enough, your body isn't neurologically efficient enough. It hasn't ingrained correct movement, so it's not second nature to you. So a lot of people, even if they do know the correct technique, they won't do it just because it's not habitual. Okay, so it needs to be practiced every day, and that's when I come back to consistency as well. And I've got a little post-surgery example there, just because many people, even in fact some of my clients as well, previous clients, have had treatment or surgery where they have either been immediately unsuccessful, or they have been successful and they've had instant relief from the pain. However, they will have had multiple surgeries further down the line if their self-care or rehab or their habits and mistakes they were making beforehand haven't changed. Then that's the reason why they've had further surgeries down the line, because surgery only removes the pain. It does not get rid of the source of the pain or the underlying reason which caused it in the first place, okay, which we've talked about previously. So obviously we want to avoid surgery for that reason as well. You don't want to get under the knife if you can avoid it. Some people will need surgery if they're too far gone. You've got disc degeneration as well. But avoid it if you can. 99% of people do not need it if you follow the correct conservative method. So multiple surgeries just shows that it's not treating the underlying problem. It's only masking the pain or removing the pain temporarily. Okay, so what do we need to do instead? Again, we've got that pyramid. So I don't know why it's done that. We want to go from the bottom up. So realise where you are at a minute. Are you stagnating? Has your progress been the same for several weeks or months now, or even years in some cases? Or are your symptoms getting worse? Okay, so only because how you would go about it is slightly different between the two. If you're declining, then you need to be a bit more sensitive and cautious because your pain will be worse. Okay, make those immediate postural changes if you need to, and avoid spinal flexion at all costs. Flexion is the main cause of your back pain, and especially herniations and disc bulges. You can actually get injuries. You can incur injuries and pain from too much extension, but it's not as common. Flexion is the main culprit for your pain, and as obviously showed you in previous slides, it's also very common if you're an office worker, driver of some sort, or you just generally sit a lot. The muscles and the joints that are required to help you stay upright, improve your posture, maintain proper technique when you're lifting, they will be compromised if your posture is not good. Okay, so that's another one, and we spoke about that. Improve your posture, be aware, make instant changes if you can or know how to. And then finally find out what's causing your pain and work backwards from there. Okay, so name loads of reasons why it can be, but most of the time it's going to be a mechanical, structural issue that you have. With your back pain, if you're feeling it in your back, 9 times out of 10, the back, it's not sourced from your back, it is somewhere around there. Muscles that are overcompensating. Anyway, we've spoken about that previously anyway. So there are 3 things you need to do. Realise where you currently are, make immediate changes, avoid spinal flexion, find out what's actually causing your pain and work backwards, and also stay consistent every day. And what will happen if you do those things, pain-free, you will be pain-free if you make these changes and stay consistent. So my case particularly took 3 months. Everyone's different, so some people might, depends on the severity of your condition obviously at the end of the day, but with my herniation they are a little bit more sensitive and they take a bit longer. So it took me 3 months, and that is still dedicating every single day towards my recovery and my success. And that's what you also need to do. And that's with setbacks, frustration daily, thinking, it's not getting any better, but eventually you will see the improvements. And now I'm back in the gym training, lifting heavy again, my technique's fine, my mobility's improved, I've spent more time in working on my mobility as well. And it's just as simple as that, guys. There is always an underlying problem to it. Okay, so information overload. Right? I hope my presentation's been of value, and I appreciate that there's a lot of information to take in as well. But at the same time, I also wanted to respect your time. But the truth is, all the information, as we spoke about in one of the earlier slides as well, is useless without implementation. So my question to you is, are you going to make sure you implement everything? Okay, or are you going to go back to usual, trying passive methods and treatments that just mask the symptoms and not actually treat the underlying problem? So it's another accident waiting to happen. Or do you want a bespoke, structured system with proper, appropriate programming and a clear pathway to your goals? If that is the case, then let's make this your defining moment now. Okay, you've had enough. You're sick of not being able to go to the gym. You want control of your life back. You don't want to rely on other people anymore. So if that's the case, then I've got something quite special for you at the minute. Obviously no pressure for you to take advantage of it, but it's my job to put it in front of you, and it's your job whether you want to take it or not. Okay, so here's your golden opportunity. I personally set aside some time to talk to you and see if I can help you further. We'll talk for roughly 60 minutes and map out an action plan for you to reach your goals, becoming pain-free and use the system I talked about today, so that you can go to the gym again, play with your kids again, blah blah blah, everything else that's affecting you as well, and also importantly keeping the results and preventing any further occurrences and injuries from happening. So if you do want to build this out together and a positive actually help you, then I might invite you to become one of my new clients. Obviously there's zero guarantee that I'll make that, and obviously no pressure for you to do anything if that is the case as well. It's down to you. So if you are interested in, here are the next steps. shoot me a message on social media with the word back in action, or you can email my personal account there, which is below, jmoffatcoaching@gmail.com. I'll respond to you with my availability as soon as I can. We'll agree on a time that works for you, and we will set up a call. And obviously there's some references and bonus material for you here as well. There's a few links there, very interesting. They all back up what I've just covered over the last 20 minutes, half an hour. And then there's some references down there with some literature that I have covered. Okay, so that's all, guys. Thank you very much for listening. I appreciate your time. And if you do have any questions, then just fire them over on social media, or you can email me. Yeah, thank you very much. Cheers, guys. Enjoy the rest of your day.